Let's get more on this story now. We'll cross to our reporter, Yanga Funani. A very good afternoon to you, Yanga. Describe for us where you are and what's happening.
A very good afternoon to you, Nzinga, and to the scores of our viewers. You are coming to us live from East London, where the Premier of the province, the Health Minister, and the rest of the top officials in the Health Department, including the MEC, are currently meeting behind closed doors. I can tell you that it's not an ordinary meeting, judging by the body language of people who are coming out of that boardroom where the meeting is being held. You'll remember that the Health Minister, Dr Zweli Mkhize, arrived here around 9. The first 2 hours is spent with the Premier of the province in a meeting which he and some of his advisors were present there. We cannot speculate what was being discussed there, but what we do know, it is the fact that the minister could not be coming to the province for the second time in a row in a space of 2 weeks, at a time where the numbers are soaring high, as you know that yesterday a further 140 infections were discovered in the province. So that's the gist of the meeting. They're trying to ascertain control measures as to curb the spread of this virus. You'll remember that people in the rural parts of the Eastern Cape, especially now in the now defunct former Transkei, are still in towns not adhering to lockdown regulations. So they're trying to ascertain what are some of these measures that are going to be put in place. Zinga.
Yanga, we know that you've raised this concern that's been brought about people not complying to lockdown regulations. What are people saying when you speak to them? Are they going about their daily business? Is the need to work trumping perhaps the fear of possibly getting infected when they're out on the streets?
Well, Nzinga, you'll remember that the province of the Eastern Cape is one of those provinces which is really suffering from the triple challenges of poverty, inequality and high unemployment. As a result of this, the social aids which came into place following the implementation of the lockdown triggered a huge number of people going to towns to sort of get their daily essentials. When we were in Butterworth just a few days ago, I think it was on Friday and Saturday, we were met there with a tragedy awaiting to happen, as people were not even wearing masks. When you go to the west of the province, far east of the province, pardon me, in the arid Mbondo land, you'll see people there going out of their homes without wearing masks, going to malls or shopping centers, and when they get there, they are not given permission to enter without really wearing masks. They will borrow from someone else who has just gotten out of the shop, something which is really triggering the spread of the virus. In the OR Tambo, you'll remember that the small town of Port St. John's is an epicenter of this virus. People there still continue not to adhere to lockdown regulations, something which has prompted the provincial government to sort of strengthen its law enforcement to a point where it has threatened to arrest anyone who still continues to go about not wearing masks, go about flocking into malls. So these are some of the things that they have put in place, but people, their need for the daily essentials, as you correctly put it, far outweighs the fear of contracting this virus, Nzinga.
And Yanga, what kind of law enforcement are we seeing? I heard you saying just now that there is a threat that people will get arrested if they're not complying. Are you seeing an increasing of deployment of law enforcement officials or the South African National Defence Force?
Well, in some of these areas we went on to, we saw, excuse me Nzinga, we're about to be joined by the Premier of the province. He might give us what really transpired in that meeting. He is now joining us. If you grant us latitude, we'll sum up within the next 3 minutes. Dear, a very good afternoon, sir. Thank you very much for joining us. Tell us, you have been in that tense meeting for more than 2 hours. What's happening inside there?
Good afternoon to viewers as well. It's not really a tense meeting. It's a quite rigorous meeting because we are going into detail. We are just trying to be pedantic on issues that are being presented. We are actually catching up from the last meeting we had in the last visit of the minister. So we are getting all those good progress that has been actually demonstrated. So we are doing fairly well. So Minister is actually quite impressed with the work that has been covered thus far.
The last time he came into the province, he left as a man who was not tickled pink with happiness. What has changed now?
That is untrue. Shadat, I'm not a spokesperson of the minister. A minister can speak for himself on this, as we all believe that he has been quoted out of context. All what he probably meant has been misconstrued. So the reality is that minister picked up issues. We are a province that is part of this country. This is a unitary country working together. Work that we are doing here, it must be complemented by the work that National is doing. National is always available to supplement where there are gaps. So minister is actually doing his work in supporting the kind of work that we are doing on the ground. He has never left this province being a disgruntled man. He was here in East London. We did some site visit together. This afternoon, he will be handing over some of the site in Makiwane that he visited being worked out on the day he was here. In PE, work was identified, the gaps were identified, particularly around tracing. That work has been now closed. We are tracing every contact that has been actually exposed to us through a person who has actually tested positive. So there is nothing of that nature, absolutely nothing of that nature, but Minister can speak for himself on that one.
Lastly, before I let you go, dear, what is he saying about the numbers that continue to soar high in the province? Last night we learned that an additional 140 people have contracted this virus. What is he saying about that?
It doesn't really need minister. It doesn't really need a rocket scientist to say what is it that informs this search on numbers. This is what we have been saying as a province. We knew exactly what happens in Western Cape. One way or other, its repercussions will be felt in this province. What happens in Gauteng, because of our socio-economic relations with these provinces, it happens to be actually felt in this. We have been saying the point that we might be peripheral to the center, but we are the center of the periphery. That's exactly what we are seeing out of what is now taking place. The numbers are growing up. We were trying to be actually be preventative. We're going for the primary health care approach as a province. And now we're a bit vindicated that what we thought we should be able to do to test people as they come in, isolate them, quarantine them, is the best approach so that they don't get into those who are highly susceptible and highly vulnerable on the ground. So the point that we're trying to do as a province was exactly to lock them. But unfortunately, that was not actually in line with the national approach and the national system, because the targeted approach, it means go there where the positive has been actually identified, look around, annex that place. So the numbers are growing up simply because we have been out there looking for virus, detecting the virus as government in the Eastern Cape. Yes, of course, because the more numbers are growing up in Western Cape, the more we are affected. Funerals, it's key. That's what I've been observing, that even during the lockdown stage, level 5 lockdown stage, the problem of funeral never stopped. There's been a traffic that has been moving between Eastern Cape and Western Cape. Those people, and we've picked it up again in that last 9 days. Looking at that number, during the lockdown level 5, we had about 99,000 cars that we were stopping there. But only in the last 7 days, we had about 52,000. It tells you the movement is actually a crisis to us. Funerals. But we are happy that our people have responded well in funeral. People are really complying with the regulation. But even 50 is too much. We don't have to have funerals. Unfortunately, when people die, they must be buried. That's why we've been saying, don't talk funerals. Talk burial. Let's just bury people. let's just put people, and then we'll be able to look at other issues at a later stage.
Lastly, Premier, doesn't the high number of people who continue to flock rural towns, especially in the now defunct Transkei, concern the leadership of the province?
It's a really concern. I must say, this is a very huge province, very geographic spread, and quite a vast province with an 800 kilometer kind of a radius from south to north, from east to west. So it's really concerning us because we're seeing these numbers. Remember, bulk of our people who are in Western Cape, in the townships there, are from this part of the province, and bulk of them are from across the Khai. That is the rural part of the province, and half of our population, it is in the former Transkei or the eastern part of the province. So there's a direct relationship in that. So the more these problems are happening, and the more people die in Western Cape, the more they are being buried in Eastern Cape. That's a really concern that we're having. That's why we've been calling for the national protocol on managing such aspects to ensure that even how to handle those kind of crops is going to be quite important, so that we don't appear to be doing our own thing as Eastern Cape. We are hysterical, or Western Cape, it doesn't really bother much, is not concerned about that. So those issues are issues that we have picked up in the system. That's why we have actually redoubled our effort, put our teams on the ground, tracing, screening. We have almost screened about 1 million people now. We have almost tested close to 30,000 people now in the province. Remember, we have started late than other provinces because we got cases a little bit later, but we knew the unavoidable is inevitable, and that situation is what is currently happening now.
Premier, thank you very much for your time, sir.
Thank you so much. Thank you.
And that's the Premier of the province, Mr. Oscar Mabuyane, telling us that the long and short of it is that they are on the ground, they are working with the people, they are containing the spread of this virus. Now, what will happen is that the Minister of Health, Dr. Zweli Mkhize, will be heading to Cecilia Makiwane, where he will be checking out some of the wards which have been set aside for COVID-19 patients. From us here in East London, it's back to you, Nzinga, in studio.